Today, we're talking about omega 3s. This is one of the most common supplements recommended to women who are in midlife. But is fish oil actually helpful, or is it just another supplement people are purchasing to try to figure out what is going on with them and to try to help support their symptoms? Now, if you are in perimenopause or menopause and dealing with inflammation, joint pain, elevated cholesterol or triglycerides, mood changes, the list goes on here, dry eyes, stubborn weight gain around the middle, especially, omega 3s may be one of the most supportive nutrients to consider. Today, I want to walk you through what omega 3s actually do in the body, what the research shows, and who may truly benefit from taking this as supplementation or eating from food. So, what are omega 3s? They are essential fatty acids, which means your body cannot produce them and you need to get them from foods or supplementation. There are two main forms we focus on, and that's EPA, which focuses with anti-inflammatory and mood support, and DHA, where the focus is brain, eyes, and the nervous system, as well as cell membrane integrity. And this is so important to have cell membrane integrity and communication so that your body, your cells can absorb the nutrients from the foods that you are eating. You primarily get these from foods that I don't like and I won't eat. So that's why I have to supplement with omega 3s. Maybe you are that way too. The foods you're going to find these in primarily are going to be salmon, sardines, mackerel, anchovies. And that's why I take the omega 3 supplements instead. Think of omega 3s as structural fats that help build healthier cell membranes and improve how your cells communicate. Again, this goes back to how well you absorb the nutrients from the healthy foods that you're eating or not. Now, why this matters in perimenopause is because as estrogen is declining, this changes the environment in your body to be more inflammatory. Estrogen normally has a protective effect with your vascular health, lipid metabolism, insulin sensitivity, inflammatory signaling, and as estrogen fluctuates and eventually declines, many women notice more joint stiffness, increased central fat gain, higher triglycerides, mood instability, dry skin, and dry eyes. They also can struggle with recovery from workouts. This is where omega 3s become highly relevant for you during this time. Now, let's break down the science quickly about this. There was a randomized controlled trial published in Brain Behavior and Immunity, and it looked at omega 3 supplementation in healthy middle aged and older adults. And it found significant reductions in inflammatory cytokine production compared with placebos. What this actually is saying in simple terms is that omega 3s are very anti-inflammatory. And this matters in your perimenopausal time because low-grade inflammation is often one of the underlying drivers of joint discomfort, changes in lipid patterns, and metabolic resistance, the dreaded central weight gain. Now, there are other benefits of omega 3s as well, and we'll discuss them here today too. And the first one I want to go over is our lipid balance and our cardiovascular protection. This is one of the biggest reasons I use omega 3s clinically in my practice with midlife women. Many come to me with their lipid panels and they're trying to avoid statins, or maybe they are on statins, but they want to have some more anti-inflammatory benefits. So they will jump on a fish oil supplementation as long as they don't have some underlying health conditions that precludes them from being on that type of medication. But what it can do is because as estrogen declines, the triglycerides and LDL patterns begin to shift. And that's where it gets your doctor nervous. When people start taking their omega 3s, they have very strong evidence for lowering triglycerides and supporting cardiovascular health. This is particularly important because cardiometabolic risk begins to rise after menopause. Keep that in mind. What many women think is just a weight issue is often a cardiometabolic issue. Remember, we talk about how everything is connected, one thing affects the other, and this is true for inflammation in our body. The next thing that it can benefit greatly is your mood and your brain. There's very strong evidence around EPA in particular when it comes to being studied for mood support, and that may be beneficial for women experiencing increased irritability from menopause, low mood, or stress during hormonal transitions. This is something that needs to be addressed because so many women struggle with mood problems. They end up feeling depressed. They may be getting on antidepressants because of it or anti-anxieties. Their emotional resilience is sort of out the door, and we need to help overcome that. Calming the brain down with good EPA could be very supportive of that, because when hormones shift, mood symptoms are not always just hormones, but sometimes it's the inflammation that's causing some blood sugar dysregulation, sleep dysregulation, and your nutrient status isn't up to par. So all of those things together can actually make your symptoms worse, and you could feel and function much worse. Now, the joint pain. This is something people talk about all the time, and I'm not talking about joint pain from an injury, although omega-3s could help with that inflammation as well. This is often an overlooked benefit when you struggle with joint pain, especially again as that estrogen declines. Women start dealing with more stiffness, soreness, or inflammation around the joints during this perimenopausal time. Again, estrogen decline, and that omega-3 will help support the joint discomfort and recovery through anti-inflammatory effects. This is something that needs to be considered too. There's many reasons to consider the omega-3s for supplementation and in the foods. Who's going to benefit the most for this? And do you think you would benefit? This is who I think should strongly consider it, as long as you're talking with a provider, as long as you don't have some underlying conditions that don't allow you to take fish oil. Sometimes other medications make it so that you should not be taking fish oil, but you need to talk to your provider about that. If you have elevated triglycerides, if you rarely eat fatty fish, that's me. If you struggle with joint pain, inflammation, discomfort, dry eyes, dry skin, and your mood could use some help. If you're starting to notice some insulin resistance pattern, or you've been told you're pre-diabetic, if you all of a sudden have weight gain happening in the middle and you cannot get rid of it no matter what, you should consider taking some fish oil supplementation. But how do we dose it? So again, this could be a little bit different depending on your situation and other medications you might be on, but you need to look at the EPA and DHA specifically. So don't just look at the main label that says 1,000 milligrams of fish oil. Instead, you need to flip the bottle over, look for combined EPA and DHA amount. That's what matters. The typical range for EPA and DHA are 1,000 to 2,000 milligrams. For higher triglycerides, this may be higher under clinical supervision. So sometimes people can push it up, and I have seen that in some cases. Now, if omega-3s are not a fat loss supplement, they're not a one-trick pony like anything else, any other supplementation. It's in the name. It is a supplement. But they can support the inflammatory and metabolic environment that often makes fat loss, recovery, and overall health harder during these hormonal transitions. This is why supplements should support the foundations, not replace them. That is a perfect thing that you need to understand, that inside the Total Health Reset, this is exactly how we approach it with labs, inflammation, blood sugar, and targeted nutrition support in order to help you feel and function your best. But like I said, there's not going to be one supplement that does all the things that you want it to do. You have to put in the efforts and build those foundations. If that sounds like you and something you want to talk about, make sure that you fill out my form, go to the show notes. And also, if you would like to have a good omega-3 supplement recommendation, check out the show notes and you can see it there as well. All right, have a great day.